Hello, welcome to this short. In this short, we're talking to Spear. We carry the Turkel needle for pleural decompression, but I thought it would be good to cover the key differences between that and the Spear and how to initiate pleural decompression with the Spear. So, first things first, with this guy, we have a blunt tip. This is our Turkel. We need to make a nick with a scalpel to initiate that perforation because it's not sharp enough on its own. So that's one thing that you're going to see with the Turkel that you won't see on the Spear. The Spear, I'm going to open it up for you. I'm going to grab it by this white portion here. It's fairly sharp. Pretty sharp tip there. This is a large diameter needle. I'm going to say it's maybe a 10 gauge, 12 gauge, and it does not have that blunt tip. So there's no need to make any sort of perforation with the Spear. Turkel, you do. Blunt tip, no blunt tip. Another key difference is going to be the pressure, or I don't want to say a pressure sensor, but you see this little, it's kind of hard to tell here, but you got a green little flashy area here. And so when I put pressure, when it's entering the patient's body, it's going to turn red. And then once I pop in to the pleural cavity, it's going to turn green. That tells me that I'm in the right space. This does not have that. This has a valve, one-way valve here for air, and once air comes across that barrier, that threshold, it's going to make kind of a honking burpee sound. Not burpee, but it's going to be more of a honky sound, and that lets you know that you're in the right space. Okay. So first, let's get into how we're using this thing. So I'm going to grab it by this white portion here, and then I'm going to take this gray portion, and there's a luer lock system here to take the sheath off our needle. So I'm going to unscrew, and that is how I'm going to take those apart. Let's get into actually performing this skill. All right. So let's zoom in on. So we have the patient's chest exposed here, and I'm going to go for the 4th or 5th intercostal space. Anterior axillary, so this is the axillary space of the patient, and I'm going to go anterior axillary. That's going to be my first spot, and that's going to be located, that anterior axillary line is going to be the anterior portion of the armpit, and where the arm meets the chest, I'm going to draw a line all the way down to the patient's toe, and that creates a line here. That is the anterior axillary space. Mid-axillary would be middle of armpit, all the way down to the feet here. One way to locate that 4th or 5th intercostal space, a guide you could use is the patient's hand. This is a little difficult with this mannequin, but I'm going to do my best here, and it actually works fairly well with him. Is I'm going to put it in his armpit, and where that pinky drops off, so right along here, this is a good place to start searching. All right, so I'm going to feel around until I get, there it is. I feel that rib space here, and so what I'm going to do, got my sharps out here, I have my located rib. I'm going to grab this white portion here, that's where I'm holding with the Spear, and I'm going to go bevel side up. When I say bevel side up, I mean that bevel is going to be pointing towards the patient's head, not towards their feet. All right. I'm going to insert at a 90-degree angle in that space. If I come across rib, I'm going to angle and go up. All right, I'm in. From here, I'm going to unscrew using that luer lock, and I'm going to hold firmly with my palm onto the patient's chest and my index finger and thumb onto the catheter. And I'm going to take that needle out, and I'm going to make sure this is placed somewhere safe. From here, I'm going to take a piece of tape, And this is fairly flexible, and what I'm going to do is I'm going to tape this down on the patient. This, this mannequin skin doesn't really like tape that well. But the key point is that I don't want it just sticking out like this. The chances of it becoming dislodged are fairly high if that's the case. So grab some sort of tape, some sort of way to maybe just tack it down to the patient's chest so that it's out of the way. And that's how you perform a pleural decompression with the spear.